This is review session 7. We ended up last time talking about filtration pressure. And just to finish up with that section on your lecture outline, right above where it says filtration rate, we have the statement that the higher the net filtration pressure, the more quickly urine forms. Now we are going on to talking about filtration rate. And recall then, and again, I'm pretty much following along on your lecture outline, that this glomerular filtration rate, GFR for short, is directly proportional to net filtration pressure. So in other words, as net filtration pressure increases, then GFR also increases. And when we're saying that the concentration of some components of the blood plasma can be used to evaluate kidney functions, remember essentially what we're saying here is that sometimes a blood test can indicate that there may be some type of problem with the kidneys. And so, for example, if a particular waste product in the blood, urea, for example, or creatinine, for example, if that particular waste product is at a higher level than normal, again, this might indicate that there's a problem with filtration, there's a problem somewhere in the kidney, and as a result, the kidney may not be able to get rid of as much of that waste product as it normally would. And so the waste product then remains in the blood and increases to high levels. From here, we talked about control of filtration rate, and two particular things then, numbered 1 and 2, here on your handout. And first of all, glomerular filtration rate, GFR, remains pretty much the same through a process called autoregulation. But number 2, we do have the ability, remember, to fine-tune GFR, and we do this by nerve impulses from the sympathetic division of the autonomic nervous system. At this point, you should be on page 784 if you're following along in your textbook and looking at figure 20.18. And we have then the A, B, C, and D labeled portions of the figure. So go ahead and locate those and which is which. A and B on the top, C and D on the bottom. And now let's follow along on your outline. And so for A, we're looking at the fact that if vasoconstriction occurs of the afferent arteriole, then this decreases net filtration pressure and then decreases glomerular filtration rate. And in the A diagram then, just as a review, notice the arrows that are pointing towards the outer portion of that afferent arteriole. These two arrows indicate then that in the case of vasoconstriction of that afferent arteriole, decreasing the diameter of that vessel, bringing blood into the glomerulus, this decreases net filtration pressure. And of course, the reason is that this squeezing partially closed of the afferent arteriole cuts down on the amount of blood that's flowing into the glomerulus, and as the volume of blood in the glomerulus decreases, then filtration rate is also going to decrease. That lower blood pressure, that lower amount of blood, is not going to be able to force out, to filter out as much plasma from the glomerulus. So B then, now we're looking at the vasoconstriction of the afferent arteriole. And again, upper right then, notice the two arrows indicating this vasoconstriction. And this then increases net filtration pressure, increases glomerular filtration rate. And what's happening here, remember, is that vasoconstriction of the afferent arteriole, squeezing partly closed of this vessel leading away from the glomerulus, is going to cause blood to not be able to squeeze through the afferent arteriole as quickly, and as a result, blood is going to back up into the glomerulus, and this increased volume of blood is going to increase blood pressure in the glomerulus, and this, of course, is going to increase the rate at which glomerular filtration occurs. For C then, so lower left, and notice now we're talking about the simultaneous constriction of both the afferent and efferent arterioles. And again, note the arrows now indicating these vasoconstrictions for both vessels. And typically then, this will slightly decrease net filtration pressure. And then finally, the D part of the diagram, so lower right, if we have vasodilation only of the afferent arteriole, if the diameter of that blood vessel bringing blood into the glomerulus increases, then of course blood will flow more quickly, more easily into the glomerulus, blood pressure will increase, and as a result of that, this will increase our net filtration rate. From here, on the next page, we got into talking about the renin-angiotensin system again, so figure 20.19. And you'll recall here we were basically looking at some new information, some things about this renin-angiotensin system that hadn't been presented earlier in the textbook when we considered this system. And recall then, one new thing in this figure has to do with where this enzyme called ACE is coming from. And from the figure then, you can see that the ACE is coming from capillaries within the lungs. Also, we pointed out that in the lower right-hand part of the diagram, so looking now at the overall effects of the renin-angiotensin system, and for specific effects then, just running through them quickly, vasoconstriction for that first bulleted point, again implying here, back to the lower left-hand portion of page 784, implying simultaneous vasoconstriction of both the afferent and efferent arteriole. And again then, this is going to, as we said, increase the amount of net filtration, and so we're conserving water here. The next bulleted point then, increased aldosterone secretion, which we had talked about earlier as a result of this renin-angiotensin system. And recall then that this causes the conservation of sodium, which in turn causes the conservation of water. Water, remember, tends to follow sodium within the body. And so again, if we're conserving sodium, we're conserving water, we're increasing the amount of fluid in the body. The third bulleted effect then, increased ADH secretion. And of course, antidiuretic hormone, ADH, has the effect of, as its name implies, causing less urine production. And so again, we're retaining fluid that would otherwise be lost as urine, lost in urine. And finally then, the fourth effect here of this renin-angiotensin system, increased thirst. And of course, drinking is also going to increase our bodily fluid levels. We next talked about tubular reabsorption and tubular secretion. And to do this, we were on page 783 looking at figure 20.1. Take just a minute again, recall what all these different columns are. And I won't take the time to go over that again. But you'll recall then we talked about the fact that substances with a lower concentration in the urine than in the filtrate have been reabsorbed. And as examples, we, from the figure, looked at sodium, glucose, bicarbonate, HCO3 minus is bicarbonate, which we'll discuss more in chapter 21 eventually. And again then, typically these are things that we want to keep, we don't want to lose in urine. And so again, things like glucose being a great example again, are going to be reabsorbed and not lost in urine. On the other hand, tubular secretion, recall what's going on here is just the opposite. And so when we have tubular secretion going on, then substances with higher concentrations in the urine than in the filtrate are an indication of secretion. And here we talk specifically about potassium, magnesium, sulfate, phosphate, and then urea, uric acid, and creatinine. And these last three in particular, then remember, are waste products, things we want to get rid of, things we want to lose from the bloodstream. And again, we're doing this through this process of tubular secretion. From here, we went back up right above where it says tubular secretion, right below where it says tubular reabsorption, and we talked specifically about sodium and water reabsorption. We're on page 788 now, looking at figure 2021. And just to quickly run through the figure, recall what's happening here is we have off to the left glomerular filtration occurring, and the filtrate then starts making its way through the tubule system. The first thing that's going on here, and notice, by the way, upper left-hand diagram, that little diagram up at the top, this is occurring in the proximal convoluted tubule. I'm not sure we mentioned that, and if not, don't worry specifically about it. But again, what's going on here then, following the numbers, following the flow of blood, following the flow of filtrate, number one, sodium ions are being reabsorbed by active transport, so moving into the bloodstream, into the capillary. Number two, bicarbonate reabsorption is linked to sodium reabsorption. So when sodium is reabsorbed, then typically bicarbonate is reabsorbed also. Number three then, as we have these materials, these dissolved materials, these solutes being reabsorbed, moving into the blood plasma, the plasma, remember, becomes hypertonic compared to the fluid in the tubule system, and so water flows from the hypotonic tubule to the hypertonic fluid in the capillary. And then finally, number four, talking about chloride reabsorption, and we said this is at least in part due to the fact that unlike electrical charges attract, sodium now has built up in the capillary, and as a result, this positive sodium draws to it the negative chloride ions. And we'll stop here with review session 7.